Hey, this is Don coming to you from the Clinical Trials Guru. Again, that's the website is www.theclinicaltrialsguru.com. One of the things I want to talk to you about is genetic informed consents, and these are, you know what informed consents are used for when you go into research. In other words, is to fully disclose what the study is about, what the risks are involved, benefits, and so forth, so that you know what you're getting into when you sign up for these studies. Well, there's one, two for genetics. And in genetics, typically what they're doing, at least what we've done in the past, is taking a sample of your blood to look at your DNA, and they may be looking at it for different reasons. For instance, they may be looking at people with schizophrenia or bipolar or depression to see if they can find something that might help determine who's going to have that, or if they can design specific medications for that illness. Who knows? There's many different reasons that they may be doing it, but anyway, the genetic informed consent is a little different than the standard informed consent you use for research. And I've just got sort of a sample generic bit of information just to share with you out there for those folks who are curious, because I know that, for instance, one study we were doing, we had two informed consents. One for people participating in the study, and if they would like to give a blood sample for a genetic part of the study, they could, and it was a different informed consent that they had to fill out. And that informed, just to let you know, the purpose again of these genetic studies is to look at the DNA and how it might affect health and disease. So for whatever you're dealing with, they're looking at that particular illness, whether it's something medical or if it's something that affects the brain. Um, you may be asked to give a blood sample, urine sample, again for this genetic research. And in that form, they may disclose what their purpose is of taking these samples and what their intentions are. A Sometimes what they may do, they may draw a little bit of blood, maybe about a teaspoon amount of blood from your body. It could be in your arm or any place like that. They may ask for a swab from inside your mouth. There's I guess, different ways to do it. I'm not, the one that's doing this stuff, so I'm typically not involved. But those are some of the ways that they can get these DNA samples. Now, the risk, they will disclose the risk involved. Some of the typical risks is that, again, if they're giving you a shot, you might feel a little bit of pain. Um, you might feel a little bit of bruising, and you may even have a little reaction from that shot, like you would do from any other shot, maybe a little swellingness or a little redness or even a little hardness. You definitely want to let someone know. Um, some people sometimes too might feel a little fainted from giving blood or getting a shot, because I know some people just have this complete fear of needles, but still be willing to step up to the plate to do this. So those could be some of the risks that are involved. Let's see. One of the risks that is eliminated, and I know some people worry about, is my name going to be tied in with this sample? Okay, are other people going to be looking at this sample and studying it and it's tied with my name? Well, a lot of times what they'll do is they'll remove your name and they'll assign a code. And that code is a way that they can track it back to where it came from, but it does not directly have your name involved. Because if they have your name and something comes up that can be chronic or whatever, it can affect you getting insurance and maybe medical insurance or some other issues, or even life insurance. And that can impact you even getting a job. Who knows? Again, to prevent this, they assign a code to that sample so it's not tied back into your name. They might take date of birth and that type of stuff, might even look at race, demographics, and things like that, so that they can kind of pull from that pool to see exactly, who has it, and who doesn't. In other words, they call that sampling. Some of the other things that they look at when you're doing this, you got to take in consideration that these samples may be used for new products, new tests. Um, Again, this sometimes too that these samples are stored, and they may be stored for a long period of time, and they might take a little bit of a time and look at it, and for different purposes. Um, One of the things that we cannot do when we're doing this, when they cannot sell your sample, unless they disclose that ahead of time, that's what their intent. If there's anything outside that consent form, they can't do. They can't be out there selling your samples out on the market, and definitely not for money. This information may be shared with other people who are involved in that, in conducting that research and trying to find out, trying to get results as a result of the sample that you provided. You directly may not receive any benefits from that. For storing it, for keeping your blood, chances are you're not going to be getting paid money for them housing your blood or anything like that. Now, sometimes coming in for a visit and giving your time to do this, you might be paid a small nominal fee for doing so. But for keeping your blood and keeping it on records or your DNA, they're not going to pay you for that. So if you're thinking that, oh, I can do that and make money off of that on a steady basis, that's not going to happen. Because there are folks out there looking for money, and that's not one way to do it. You might get paid, again, a nominal fee just for coming in and giving a blood sample. One of the things to be aware of, though, this is no cost to you. Again, these tests are done to help people who might have your illness in the future and develop better medications or be able to detect these illnesses ahead of time. Those are some of the things that they're looking at. One of the things that please be aware of that you can do, that you can actually have that sample pulled anytime, because you'll have your consent form. That code, there should be something on the consent form that relates back to that code, which will help them tie that back into you. You can go to the private investigator, which is the physician or anyone that's working with that study, and say, hey, look, I know my samples have been there and it's been there for a year. I'd like to have it destroyed. I'm not comfortable with it being just sitting out there anymore, so I want to have it destroyed. You can do that as well. So anyway, that's just a very compact, quick example of of an informed consent for genetics, for DNA testing and things like that. Again, it's different than the actual informed consent that you sign when you go into into a research program, some of these outpatient and inpatient programs. I hope this information helps you. This is Don signing off from theclinicaltrialsguru.com. Have a beautiful day.